What hurts most about diabetes isn't avoiding sweets or counting carbs. It's waking up in the morning with hope, checking your blood sugar, and seeing the number higher than you expected. You did everything right. You ate carefully. You skipped dessert. You stopped eating early. And still, your fasting glucose rises overnight. That moment feels frustrating, confusing, even unfair. But here's what most people are never told. Blood sugar at night is controlled by completely different forces than during the day. While you sleep, insulin becomes less effective. Stress hormones slowly rise and your liver quietly releases stored glucose into your bloodstream, even if you haven't eaten anything for hours. This is why morning numbers can climb without warning. It's not about willpower, it's about nighttime biology. The good news is this: the right bedtime nutrition can calm that process instead of triggering it. In this video, you'll discover 3 specific nut butters that work with your body while you sleep. When eaten the right way in the right portion, they help stabilize hormones, improve insulin signaling, reduce liver glucose release, and support lower fasting blood sugar over time. Watch until the end because sometimes one small spoon before bed can change how you wake up tomorrow. First on the list, natural peanut butter. When fasting blood sugar rises overnight, most diabetics blame dinner. But in many cases, the real issue isn't what you ate at 7 GTO p.m. It's what your liver does at 3:30 in the morning. While you sleep, insulin sensitivity naturally declines. Muscles become less responsive. Stress hormones begin to rise, and your liver starts releasing stored glucose into your bloodstream to prepare your body to wake up. This process is called nocturnal H-hepatic glucose output. In insulin-resistant individuals, that release becomes exaggerated. The result? You go to bed at 115 mg orange per deciliter and wake up at 155. This is exactly where natural peanut butter becomes metabolically strategic at night. Peanut butter has a glycemic index of approximately 14, which is extremely low. More importantly, its glycemic load per tablespoon is under 1. That means it does not spike blood sugar directly. Instead, its power comes from how it influences hormonal and metabolic stability during long fasting hours. 1 teaspoon of natural peanut butter contains about 4 grains of protein, 8 grains of healthy fats, and around 12% of the daily value of magnesium. That combination matters more at night than during the day. Let's start with fat metabolism. The healthy monounsaturated fats in peanut butter slow gastric emptying. When you eat 1 tablespoon about 30 minutes before bed, digestion slows gently, sending a steady stream of energy signals to your brain. This prevents the body from interpreting nighttime as a stress state. When the brain senses insufficient fuel during sleep, it triggers cortisol release. Cortisol then signals the liver to release more glucose. That's one of the main drivers of morning spikes. Peanut butter reduces that stress trigger response by signaling energy sufficiency. Now let's talk about magnesium because this mineral is often overlooked in diabetes care. Magnesium is required for insulin receptor activity. Without adequate magnesium, insulin cannot efficiently move glucose from the bloodstream into muscle cells. Many people with type 2 diabetes are mildly magnesium deficient due to urinary losses and chronic inflammation. At night, when insulin sensitivity is already lower, that deficiency becomes more pronounced. By providing a steady source of magnesium before bed, peanut butter helps strengthen insulin signaling during sleep. Over time, improving magnesium intake can improve insulin sensitivity by 10 to 20% in deficient individuals, which directly impacts fasting glucose levels. The protein content also plays a critical role. Muscle tissue is the largest glucose-absorbing organ in the body. During sleep, muscle repair and recovery occur. When muscle cells are nourished with small amounts of amino acids before bed, they become more metabolically active and more responsive to insulin the next morning. That improves glucose uptake efficiency. Even 4G of protein can make a meaningful difference in overnight metabolic signaling. There is also an effect on glucose variability. HbA1c is not only influenced by average glucose, it is influenced by swings. Nighttime glucose swings are especially damaging because they last longer and go unnoticed. By stabilizing hormone output and slowing glucose release, peanut butter reduces overnight variability. Over 8 to 12 weeks, improving nighttime stability can reduce HbA1c by approximately 0.3 to 0.6 percentage points in individuals whose primary issue is elevated fasting glucose. Imagine someone whose HbA1c is 8.1%, largely driven by high morning readings. If fasting glucose drops consistently by even 15 to 20 milligers per deciliter over 10 to 12 weeks, that HbA1c could gradually move towards 7.5 to 7.6%. That reduction significantly lowers the risk of diabetic neuropathy, kidney strain, and cardiovascular stress. Another mechanism worth understanding is ghrelin and leptin regulation. Ghrelin is the hunger hormone. When blood sugar dips or fluctuates at night, ghrelin rises, triggering subtle stress signals that increase cortisol. Peanut butter's fat and protein suppress ghrelin release and stabilize leptin signaling, reducing that hormonal cascade. This creates a calmer metabolic environment through the night. Peanut butter also supports gut stability. Even during sleep, the gut remains metabolically active. Healthy fats help maintain intestinal lining integrity and reduce inflammation. Lower inflammation improves insulin receptor responsiveness systemically. However, precision is critical. The ideal portion is 1 tablespoon, approximately 16 degree, eaten alone or paired with a few almonds 30 minutes before sleep. More is not better. 2 or 3 tablespoons can slow digestion excessively and interfere with sleep quality. And poor sleep worsens insulin resistance the following day. Quality matters deeply. Choose natural peanut butter with only 1 ingredient, peanuts. No added sugar, no hydrogenated oils, no palm oil. Even small amounts of added sugar can defeat the nighttime purpose by triggering glucose fluctuations. A common mistake diabetics make is spreading peanut butter on toast before bed. That combination reintroduces carbohydrates and can spike glucose. At night, peanut butter should function as a metabolic stabilizer, not a dessert. Clinical nutrition observations show that individuals who implement a structured protein-fat bedtime strategy often see fasting glucose reductions of 10 to 25 milligrams per deciliter within 2 to 3 weeks. The key is consistency. One night will not transform your readings, but 60 to 90 nights of stability compound into measurable change. There's also a sleep quality effect. Stable blood sugar promotes deeper, uninterrupted sleep. Better sleep improves next-day insulin sensitivity by improving muscle glucose uptake and reducing cortisol. This creates a positive metabolic loop. Better sleep leads to better glucose control, and better glucose control leads to better sleep. One general caution: peanut butter is calorie dense. If weight management is a primary concern, monitor total daily intake. The goal is metabolic stability, not excess energy consumption. Peanut butter is not a miracle cure. It does not replace medication, but when used intentionally, it becomes a powerful nighttime tool. It aligns with your body's biology instead of fighting it. It calms liver glucose output. It strengthens insulin signaling. It reduces hormonal stress, and over time, it protects your long-term markers like HbA1c. That's why natural peanut butter earns its place as the first nut butter diabetics should consider at night to lower fasting blood sugar naturally. Second on the list, almond butter. If peanut butter works by stabilizing energy and supporting magnesium intake, almond butter works at a deeper cellular level through mineral density, insulin, receptor sensitivity, and inflammatory control. For many diabetics, especially those whose fasting blood sugar remains stubbornly high despite controlled daytime meals, the The issue is not simply food intake. It is reduced nighttime insulin responsiveness combined with subtle chronic inflammation that keeps the liver in glucose release mode. Almond butter addresses both. Let's begin with glycemic impact. Almond butter has a glycemic index close to 0. Its glycemic load per tablespoon is negligible. That means it does not directly elevate blood glucose. Instead, it influences how the body processes glucose already present in the bloodstream. 1 teaspoon of natural almond butter provides approximately 20% of the daily value of magnesium, 3 to 4 g of protein, 9 grain of healthy monounsaturated fats, and small but meaningful amounts of vitamin E and manganese. That mineral concentration is where its nighttime advantage begins. Magnesium is one of the most critical minerals for insulin receptor activation. When insulin binds to its receptor on the surface of a muscle cell, magnesium is required for the signaling cascade that follows. Without adequate magnesium, insulin binding is weaker and glucose transport into cells is less efficient. During the night, insulin sensitivity naturally decreases. This makes magnesium availability even more important. Studies show that individuals with magnesium deficiency often experience higher fasting glucose and greater insulin resistance. Supplementing magnesium or increasing magnesium-rich food intake has been shown to reduce fasting blood sugar by approximately 12 to 15 millimoles per deciliter in deficient individuals over several weeks. Almond butter provides this support in a food-based bioavailable form, but magnesium is only one part of the story. Almond butter is rich in monounsaturated fats. These fats improve membrane fluidity of cells, including muscle cells. When cell membranes are more fluid and less inflamed, insulin receptors function more effectively. Chronic inflammation stiffens cell membranes and impairs glucose uptake. By reducing inflammation over time, almond butter enhances insulin responsiveness, especially during overnight fasting hours. Vitamin E is another overlooked benefit. 1 tablespoon of almond butter provides roughly 25 to 30% of the daily value of vitamin E. Vitamin E is a powerful antioxidant. Overnight, oxidative stress increases in individuals with elevated glucose. High glucose levels generate free radicals that damage cells and worsen insulin resistance. Vitamin E helps counteract that oxidative stress, protecting insulin receptors and vascular function. Over time, this protection contributes to better HbA1c stability. Now let's talk about nighttime hormones. During sleep, cortisol begins rising in the early morning hours. This is part of the normal circadian rhythm, but in people with diabetes, that cortisol rise can become exaggerated. Elevated cortisol signals the liver to release glucose. Almond butter helps blunt this response indirectly by stabilizing leptin and ghrelin, the hormones that regulate hunger and energy sufficiency. When the brain senses inadequate energy during sleep, it triggers stress signals. Almond butter eaten 20 to 30 minutes before bed provides just enough fat and protein to signal nutritional sufficiency without causing a spike. This reduces nighttime stress activation and helps keep liver glucose output controlled. Another powerful mechanism is the impact on glucose variability. Many diabetics focus only on average glucose levels, but variability, the swings between highs and lows, plays a major role in long-term damage. Nighttime swings are particularly harmful because they persist for several hours unnoticed. Almond butter creates a slow, steady metabolic environment. Its fat content slows digestion, preventing sudden drops that trigger counter-regulatory hormone responses. Its protein content supports gradual amino acid release, maintaining stability over 8 to 12 hours. Reducing nighttime glucose variability can lower HbA1c by approximately 0.3 to 0.7 percentage points, especially in individuals whose primary issue is fasting hypoglycemia, rather than post-meal spikes. That reduction significantly decreases the risk of neuropathy, kidney strain, and cardiovascular complications. Imagine someone with fasting glucose consistently around 150 mg per deciliter despite controlled meals. If almond butter helps lower that to 130 to 135 mg per deciliter consistently, the cumulative glucose exposure across 90 nights changes dramatically. That cumulative reduction is what improves HbA1c. Almond butter also supports muscle glucose uptake the following morning. Magnesium enhances GLUT4 transporter activity, the mechanism that moves glucose into muscle cells. While we don't need to overemphasize molecular pathways, it's important to understand that better magnesium status improves glucose disposal efficiency. When muscles are more responsive in the morning, fasting numbers decline. There's also a sleep quality effect. Magnesium has a calming influence on the nervous system. It supports GABA activity, which promotes relaxation. Better sleep improves next-day insulin sensitivity by reducing inflammatory markers and lowering cortisol. This creates a reinforcing cycle. Almond butter supports sleep. Sleep supports insulin sensitivity, and insulin sensitivity supports lower fasting glucose. Portion precision is essential. The ideal amount is 1 teaspoon, approximately 16 grams, eaten 20 to 30 minutes before sleep. It can be eaten alone or paired with 1 prune or 1 dried apricot for individuals who experience the dawn phenomenon. The fat in almond butter slows glucose absorption from the fruit, preventing spikes. Quality matters. Choose raw or dry roasted almond butter with no added sugar and no palm oil. Many commercial almond butters include sweeteners that negate nighttime benefits. A common mistake is overconsumption. Almond butter is healthy but calorie-dense. 2 or 3 tablespoons may impair digestion at night, potentially disrupting sleep and offsetting metabolic gains. Precision beats excess. Another consideration is sodium. Avoid salted varieties. Excess sodium can increase nighttime thirst and disrupt sleep quality, indirectly worsening glucose. Control. Encourage consistency rather than immediate perfection. Track fasting glucose trends over 10 to 14 days. Look for gradual reduction in morning variability. Then monitor HbA1c over 8 to 12 weeks. The compounding effect of small nightly improvements is what creates measurable long-term change. Almond butter is not about sweetness. It is not about flavor indulgence. It is a nighttime metabolic tool. It strengthens insulin signaling, reduces inflammation, supports mineral balance, stabilizes stress hormones, and protects long-term markers like HbA1c, all while the body rests. That is why almond butter earns its place as the second nut butter diabetics should eat at night to support lower fasting blood sugar and healthier long-term glucose control. Third on the list, pistachio butter. Pistachio butter may not be the first thing people think about when trying to lower fasting blood sugar, but metabolically it offers something very unique. When morning glucose stays high despite careful meals during the day, the issue is often happening in silence during sleep. While you rest, insulin sensitivity drops naturally. Muscles respond more slowly. Cortisol gradually rises toward early morning, and your liver quietly releases stored glucose into your bloodstream to prepare you to wake up. In someone with insulin resistance, that release becomes excessive. You can go to bed stable and wake up 20 or 30 points higher without eating anything at all. This is where pistachio butter becomes strategically powerful at night. Its glycemic index is extremely low, under 15, and its glycemic load per tablespoon is negligible. That means pistachio butter does not spike blood sugar directly. Instead, it works behind the scenes by improving how your body manages glucose while you sleep. 1 teaspoon of pure pistachio butter provides roughly 3 grain of plant protein, nearly 9 grain of predominantly unsaturated fats, meaningful potassium, around 15% of the daily value of vitamin B6, and a rich profile of antioxidants, including lutein and polyphenols. That combination affects nighttime metabolism in several interconnected ways. One of the least discussed factors in fasting blood sugar is blood vessel function. In diabetes, the inner lining of blood vessels called the endothelium becomes inflamed and less responsive. When circulation is impaired, glucose delivery into muscle cells becomes inefficient. Even if insulin is present, glucose cannot move smoothly into tissues because the transport system is sluggish. Pistachios are naturally rich in arginine and antioxidants that improve endothelial function. Better vascular flexibility allows glucose released overnight to be delivered more efficiently into muscle tissue instead of lingering in the bloodstream. Over weeks, this improves fasting trends. Studies in individuals with metabolic syndrome have shown that regular pistachio intake can reduce fasting blood sugar by 8 to 12%. That may not sound dramatic, but when compounded over months, it significantly changes HbA1c outcomes. There is also a powerful gut-to-liver connection at play. During sleep, your gut bacteria remain active. They ferment fiber and produce short-chain fatty acids that send chemical signals to your liver. These signals influence how much glucose the liver releases. Pistachios contain prebiotic fibers that feed beneficial bacteria. When pistachio butter is eaten before bed in a small portion, it supports overnight fermentation. Those short-chain fatty acids gently tell the liver that energy is sufficient and excessive glucose release is unnecessary. In simple terms, pistachio butter helps calm the liver's overreaction. Vitamin B6 adds another layer of benefit. This vitamin plays a role in neurotransmitter balance and stress regulation. Many people do not realize that emotional stress and subtle nighttime anxiety can elevate cortisol levels. Elevated cortisol directly increases hepatic glucose output by supporting balanced neurotransmitter production. Pistachio butter indirectly helps regulate that cortisol surge that happens in the early morning hours. Potassium also contributes quietly. Mild mineral imbalance or dehydration can elevate stress hormones overnight. Pistachio butter provides natural potassium that supports adrenal balance and fluid stability, both of which help moderate cortisol-driven glucose release. Oxidative stress is another hidden driver of poor fasting numbers. Elevated glucose increases free radical production. These free radicals damage insulin receptors and blood vessels, making insulin signaling less efficient. Pistachios are rich in antioxidants such as lutein and polyphenols that neutralize oxidative stress, lower oxidative stress, improves insulin receptor responsiveness, and protects vascular tissue, both of which support lower fasting glucose over time. Nighttime glucose variability is particularly harmful because it goes unnoticed. A drop followed by a stress-induced spike creates instability that pushes HbA1c higher. Even if daytime numbers look reasonable, pistachio butter's balance of protein and fat creates a slow, steady metabolic environment. It prevents sudden dips that would trigger counter-regulatory hormones. Instead of a roller coaster, glucose follows a smoother curve through the night over 8 to 12 weeks. Improving overnight stability can reduce HbA1c by approximately 0.2 to 0.5 percentage points in individuals whose main problem is fasting hypoglycemia. For someone with an HbA1c of 7.9%, even a reduction towards 7.4% meaningfully lowers the risk of nerve damage progression and kidney stress. There is also an appetite regulation effect. Pistachios help balance leptin and ghrelin, the hormones that regulate hunger and energy sufficiency. When ghrelin rises at night, subtle stress signals follow. Those signals increase cortisol and glucose release. Pistachio butter provides enough fat and protein to suppress that hunger-driven stress activation without overwhelming digestion. Portion control remains essential. The ideal amount is 1 tablespoon eaten about 30 minutes before sleep. It should be consumed alone, not spread on bread or paired with crackers. Adding carbohydrates changes the hormonal effect and can reintroduce spikes. Precision matters more than quantity at night. Quality also matters. Many commercial pistachio butters are blended with added oils or sweeteners. Choose pure pistachio butter with no added sugar and no seed oils. Added sugar defeats the purpose. Added oils dilute the nutrient density and may increase inflammation. One gentle reminder is digestion. Pistachios are nutrient dense and calorie dense. Eating more than 1 tablespoon may slow digestion excessively and disrupt sleep. Poor sleep increases insulin resistance the following day. Again, nighttime strategy is about precision. Encourage consistency rather than perfection. Track fasting trends over 10 to 14 days. Look for smoother patterns rather than dramatic overnight drops. Then reassess HbA1c over 2 to 3 months. The cumulative effect of small nightly improvements is what transforms long-term markers. Pistachio butter is not simply a flavorful spread. It is a vascular supporting, gut signaling, stress regulating nighttime tool. It improves circulation, calms the liver, balances hormones, reduces oxidative stress, and stabilizes glucose exposure while your body rests. That is why pistachio butter earns its place among the top nut butters diabetics should eat at night to support lower fasting blood sugar and healthier long-term glucose control. Fasting blood sugar doesn't change by accident. It changes by what happens while you sleep. And every single night gives you a new opportunity to calm your liver, stabilize your hormones, and protect your long-term health. These nut butters aren't magic. They're strategic. Small, consistent choices before bed can slowly reshape your morning numbers. If this helped you understand your fasting sugar better, subscribe for more science-backed practical strategies. And tell me in the comments which nut butter are you trying tonight? Because tomorrow morning starts with tonight's decision.